Thank you for watching Checkpoint and welcome back. Following the Trump administration's decision to halt funding for essential health services in the country and other developing nations, concerns are mounting over a potential surge in global populations and a rise in diseases such as HIV and AIDS in Kenya. The shortage of critical family planning options could lead to a baby boom. Katie and Noel Nabiswa reports in this special feature titled Contraceptives Conundrum. Take a look.
Mukuru kwa Ruben slums, a backwater settlement that captures the less glittery of the biggest city in East Africa, Nairobi. Here, life is tough and the residents even tougher. The high number of residents capturing the booming population of Kenya that is said to spike even more if conditions feared by experts prevail. Meet Sylvia Msumba. She's a community health promoter and today she's on the beat.
Watoto ambao unaweza kuwalea.
She oversees about 100 households where documenting the number of sexually active individuals, expectant and breastfeeding mothers is part of her duty.
Tuko na mbinu kadhaa za upangaji wa uzazi. Hizi mbinu sisi kama wahudumu tumeelimishwa na wale health providers. Na wakiwa wametufunza hizo mbinu zote, ndio sisi tunaenda kule mashinani, tunafundisha wamama kule chini.
She has witnessed frustrating moments when the women she serves suffer contraceptive stockout.
Wamekuwa wakichukua hizi mbinu za family planning bure kwenye hizi hospitali zetu za serikali. Ile tu kwamba saa hii kuna challenges nyingi zenye ziko. Unapata ya kwamba saa zingine mama anakuja hospitali, anapata hakuna hizo dawa. Anakuja, anapata pengine yenye amekuwa akitumia haipo, iko ile nyingine. So mama ana have kubadilisha bila kupenda, kwa maana hiyo ndiyo amependa, hiyo ndiyo amepata yenye iko. Na then saa hii tena venye tunaangalia, tunaona nikana kwamba kwingine mgonjwa akienda anaambiwa hakuna dawa. Kwa muda mchache unaokuja nafikiri ya kwamba hakutakuwa na madawa kwenye hizo hospitali zetu za serikali za upangaji wa uzazi. Na mimi kama mhudumu nilikuwa naomba serikali ya kwamba wakuje na mbinu ambayo itakuja kufit hawa raia kama ile yenye ilikuwa ya USAID. USAID wamekuwa wakileta madawa, zinakuwa accessed kwa hizo hospitali zetu kwa bure. Na saa hii kama ni kulipa, najua population inaenda kuongezeka kiini na sababu mpango wa uzazi unaenda kukua gali.
Frida Kanini is a mother of 3. She has been relying on a 3-month injectable contraceptive for a while now. It worked well until the inevitable happened.
Nikizaa mtoto wa kwanza, nikatumia miaka 3 ikafika. Sasa venye niliacha, nikapata huyu wa pili. Sasa nikaona hiyo inipendezi. Nikaanza kutumia hizi ndawa za kumeza. Nikameza mimi mwaka 1.5 nikapata, sijui haikufanya kazi, haikufanya nini, nikapata mtoto wa 3.
But with the ongoing stockout crisis, she fears that another baby might just happen.
Na kuzaza hivyo ni shida sahi. Si kama wakati wa kitambo. Wakati wa kitambo unajua watu walikuwa na vitu mingi, lakini sahi maisha ni ngumu.
Still here in Mukuru kwa Ruben, Sarah Njeri is a mother of 2. Her eldest son is now aged 21, while the second one is a daughter aged 12. The gap between her 2 children was occasioned by a painful experience.
Na ile CS nilifanywa ikukuwa sawa, kwa sababu nilifanywa alafu nikapasuka. Kupasuka, kuponyesha ile kidonda ikawa ni shida, lakini ilikuja ikapona. Secondly nikapata mimba ya 2. Hiyo iko ni dhurumu sana kama ile ya kwanza, lakini nayo nilikuwa bado na shida. Bwana yangu akaamua akaniambia hakuna haja ukuage tu Ninaona nitakupea mimba ingine tena unipotelee au ukufe uniache na watoto. Si uamue ile family planning utatumia.
The biting shortage of contraceptives being felt in this settlement only highlights the bigger challenge being faced in many parts of Kenya. For decades, family planning has been dependent on donor funding from as far as 1967. So entrenched by the program that in 2021, the Ministry of Health, together with the United States Agency for International Development, or USAID, the Bill and Melinda Gates Foundation, and the UK's official development agency, UKAID, signed a memorandum of understanding to support family planning security in Kenya. It was expected that the government will fully finance the distribution of family planning commodities and services from 2026. The agreement required the government of Kenya to provide matching funds that donors will complement. While USAID began its support in 2021-2022 financial year under the memorandum, the Bill and Melinda Gates Foundation withdrew its funding in 2022-2023 due to the Kenyan government's failure to remit its commitment funds. These are some of the contributing factors that continue to stroke Njeri and many women's fears. However, the situation has been compounded by the recent stop-to-work order signed by the US President Donald Trump after he assumed office. It has left thousands of women vulnerable to unintended pregnancies, unsafe abortions, not to mention exposure to sexually transmitted diseases, including HIV/AIDS. Nationally, Kenya adopted family planning commitments that partly seek to increase modern contraception from 58% to 64% by 2030. However, with donor priorities shifting, Kenya must increase domestic funding for family planning to achieve its commitment. A report by the Kenya Medical Supplies Authority, or KEMSA, obtained by the KTN speaks of a stockout of some family planning commodities. Availability of others still remains limited. Among the contraceptives currently out of stock are injectables and the pills. The levonorgestrel intrauterine device, ethinyl tablet, and medroxyprogesterone acetate injection, despite Kenya's monthly consumption of these being over 1,000, at least 44,000 and 83,000 respectively, are also missing from the KEMSA stores. Although some stock is available at KEMSA, the supply remains insufficient to meet national needs. Despite dwindling donor support, the government is yet to fully fund family planning, a gap experts warn could trigger a baby boom, where births could triple from the current 1.5 million annual births.
The usage of modern contraceptives, you can predict that you are reducing the fertility rate of the country. The population growth is almost measured. You can measure and say, by the way, if we were here, we will not grow by more than 0.2%, meaning that allocation of resources to counties, will be done with that in mind. But when you have haphazard growth, family planning is not there. You are having haphazard growth that cannot, which means that our policymakers cannot predict the growth, but it is going up.
This could have a ripple effect in the form of increased demand for vaccination, antenatal care, and maternal health services, hence straining the national budget. While discussions on sustainable financing are ongoing, there are questions about budgetary allocation.
One of the things that I think makes it very difficult to have allocations of financing for commodities, is because in this country, health is seen as a disease that needs to be cured. whereas FP is not something you use because you're sick. And so the lack of awareness about how important family planning is what makes it so difficult for financing to be set aside for family planning.
The 2023-2024 financial year shows the most drastic reduction in Kenya's budgetary allocation for family planning over the years, even with the plans to self-sustain by 2026. For instance, under 2022-2023, allocation for family planning was 1.2 billion shillings that was scaled down to 500 million shillings. Eventually, no money was disbursed to these critical procure commodities in the same financial year. In 2023-2024, no disbursements were made against the allocation of 1 billion shillings, while in 2024-2025, only 150 million shillings has been released to procure family planning commodities, way below the budget allocation of 1 billion shillings. With declining donor support and zero domestic disbursements, health indicators on maternal and child mortality are compromised. This could have a spiking effect on population of the country. Organizations have been expanding access to family planning commodities through pharmacies under the Optimizing Pharmacy Channel initiative. However, public health facility remains the largest provider of these services.
We've been working with the ministry since 2016 to empower and to create more roles for the pharmacies, just recognizing that they have a big role to play in terms of primary health care. This is also informed by WHO through a high impact practice, looking at pharmacies as service delivery points for family planning.
To avoid losing gains made over the years, calls are now being made to scale up on local funding and avoid depending on donors.
Of course, donors have changing priorities from time to time. So as a country, we have to keep monitoring what those priorities are. If donors are changing their priorities for support of family planning, it will require that as a country, then we map up our own domestic resources to cover the shortfalls that may come with that. We are also hoping that when some donors reduce funding in family planning, others would come up and help to cover that shortfall. So I think those international rearrangements happen, but as a country we have to track them and then see how best we can be able to respond.
Currently, Kenya has a population of at least 55 million people, according to the latest census. But with the expected baby boom, a strain to the dwindling resources, coupled with corruption that has been compromising the distribution of the national cake, a bleak future awaits. Yet, it can be mitigated. As donor funding to the health sector dwindles, Kenya, just like many other countries who have been relying on donor support, is now being forced to look for alternative options to fill the gap. And to the women who have been relying on family planning, it's the real risk. Noel Nabiswa, KTN.